Welcome to the Wichita Eldercare channel, brought to you by Stan Webb, Principal with Dreamcatcher Wealth Management. Today's guest is Ms. Tisha Catlin, registered nurse and Director of Marketing Operations for Wesley Rehabilitation Hospital.
Hi, this is Stan Webb, and I'm here with Tisha Catlin, and she's with the Wesley Rehab Hospital here in Wichita, Kansas. Welcome, Tisha.
Welcome. Thank you.
Tell us a little bit about what is Wesley Rehab Hospital and what does it do?
Okay. Well, we are a hospital level of rehabilitation. We work with patients for a variety of reasons. We work with them short term with the goal to get them back home again, back to doing the things that they like to do in the community. We have physical therapy, occupational therapy that works with upper body strengthening and helps with things like everyday that we do every day that we don't even sometimes think about. Getting dressed, bathing, cooking, all those things. And then we also have speech therapy in-house, and they work with vocalization as well as swallowing to help people with that. We have physicians, since we are a hospital, we have physicians that see patients every day. We have specialized physicians, and they specialize in physical medicine and rehabilitation. They're physiatrists, and that's really what they focus in on, is making sure that patients are getting the correct therapy to get the optimal benefit out of their rehab.
So would you say then that this is the ultimate level of care that one would get if they needed any kind of rehab?
Right. Yes. A hospital level is a little higher level of therapy, a higher level of care. It's about 15 hours of therapy a week. It's split up into 30-minute sessions at a time to help build, patients' endurance back up. But it is a higher level than somebody would get at, say, a skilled nursing or something like that.
What would you say would be the typical types of patients that you may see? What type of, injuries or rehab would they need?
We see people for a variety of reasons. It might be that they've had a stroke. Maybe they've fallen and had a hip fracture, maybe an amputation, a motor vehicle accident, just a wide variety. And sometimes it's just that somebody's, maybe they weren't feeling real great before that, maybe they were a little weak anyway, and then they got something like the flu or something that just caused them to be weaker. So it isn't even always a major illness that causes people to be weak and not able to function as well. So we take people for a wide variety.
Is there any age group that you take?
We will take anybody age 12 and above. We see people, again, kind of depending on the diagnosis. It might be a different kind of age population. A lot of the motor vehicle accident people that we see are 20s, 30s. We are seeing a lot of younger strokes these days, and in the last couple of years we've noticed a trend. We're seeing a lot of people in their 40s who are having pretty significant strokes.
We don't really think about that. We think of strokes as being, older, but there again, it proves anything can happen at any time.
Exactly.
Is there, how would one know that they needed some type of physical therapy? Would it be from the hospital? Would it be from the doctor? Would it be something that a loved one would notice, about someone that they're not getting around?
Actually, we get referrals from all three of those sources.
Oh, wow, okay.
Yeah, we have a lot of patients who come to us from the hospital. Obviously, if they've had a stroke or a motor vehicle accident or something like that, they tend to come from the hospital. Sometimes it's patients who, they go to see their doctor, they've been falling a lot at home, maybe they have a progressive neurological illness, like multiple sclerosis or Parkinson's disease. We see a lot of people who have those types of illnesses that come in and see us. And then sometimes we just get calls from family members that say, mom's not able to get up like she used to, or she's falling a lot, or she can't do these things. And we send a nurse out and do an evaluation with them and see if they qualify under their insurance. And then we can provide transportation to get them into the hospital and really focus on what their goals are and what things they need to be able to do to be safe at home.
So, just to be clear, if just a loved one, like you said, notice that, mom's not getting around, it would be okay to give you guys a call.
Absolutely.
And then you would be able to do an evaluation. Is it in-home evaluation?
Yes. Yeah. We send a nurse to their home to kind of evaluate how they're doing, visit with them, visit with the family, and then we can contact the doctor. Sometimes we see patients who don't have a primary care doctor. Maybe they haven't been for a while, so we do see patients that who don't have a doctor as well. We don't have to have a physician order to send a nurse out to do the evaluation.
What kind of insurances do you take?
We are actually in network with almost all providers. We take Medicare, obviously, and then all the commercial insurances. If it's a smaller one that we're not in network with, we can do a one-time agreement with them, usually. And then we also take Medicaid. Medicaid as well.
So there's really not a good excuse for someone not to get physical therapy.
That's right.
To help them to be more active.
Right. We want to focus on quality of life. If you have become so weak that all you're able to do is to just get from your chair to your bathroom or to your chair to your bed, that's not really the quality of life that most people want. So we want to focus on what that person's goals are and be able to help them achieve those goals or get as close to that as possible.
And what area do you service? Is it just Wichita, surrounding counties, the state? What areas?
We actually take patients from all over the state. Especially some of the rural hospitals will send us information, and we can just do it all by phone and get all of our information that way. Obviously, Wichita, Butler County, Cali County, all those areas are very easy for us.
But really, anywhere in the state. Mm-hmm. Now that tells me that there's not very many rehab hospitals available. Is that true?
Correct. That's correct. There are only two in the Wichita area. We do have two sister hospitals in the state, one in Topeka and one in Kansas City. And then there is also a rehab hospital in Garden City. But otherwise, there aren't a lot of hospital level rehab choices in the state.
And if I might ask, what would someone need to know if they needed a higher level of rehab than, say, from a sprained elbow from playing tennis or something?
I think it comes down to what your functional level is. If, like you say, it's just a sprained elbow, you can probably take care of that in an outpatient setting because you're able to manage most of your other activities of daily living. You're still able to be ambulatory. You can still, for the most part, get yourself dressed and do those types of things. But if somebody is finding that they're not able to do just those routine activities of daily living, that's when it's time to look at.
And if someone's, if someone's not sure what level, it would still be better to call you.
Absolutely.
And then you can do a quick question and answer on the phone, and then if need be, send someone out to do an evaluation.
Exactly. And a lot of times we will see patients who, maybe they don't really need to be at our level of rehab, but we can help them get set up with some other services, whether it be outpatient or home health or whatever it might be to help them.
Well, that's great. Can you just happen to think of someone that you guys were really able to help and make a real difference in their lives because they came to you or was sent to you, but because of what you were able to do to get them back into normal functioning or normal for them, is there a story that you'd like to share?
Oh, we have several. We have recently had a lady who, she was still very active. She was about 60 and she was a substitute teacher and she had a stroke. And when she came to us, she was still needing a lot of help, was at a wheelchair level, and she walked out of our hospital with a cane with her family.
Oh, wow.
And, yeah, so she recovered very well and was going to be going back to substitute teaching again.
I'm sure she was very happy, right?
Yes, she was very happy.
Well, if someone wanted to get in touch with you guys, how would be the best way to contact? Either email, phone, both, website?
Probably the easiest way is to just give us a call, and it's 316-729-9999. It's an easy number, and they can that will get them in touch with our main number, and they can either direct that person to inpatient rehab, or we do have outpatient rehab. So whatever they're interested in, then they can just get them directed to that department, and we can get them set up with.
So no need to watch one of your loved ones suffer with getting around.
Right.
When maybe a simple phone call, you may be able to help that loved one to inspire or to get that loved one in to maybe get some rehab, and they may not really be as weak as they initially thought.
Right.
It may just need some rehab, not surgery or something like that. And of course we don't know, but that's just how we start finding out, right?
Exactly. If you're noticing over the last month or two that your loved one is getting weaker, it's time to get something started right then, as opposed to waiting 6-8 months. The sooner that we can start the rehab process for somebody, the better the results tend to be.
Tisha, thanks so much for being on the Eldercare channel, and glad that you were sharing this information to all of our viewers.
Yes, I'm glad to be here. Thank you for having me.
Thanks so much.